Okay, hello everyone. Thank you for coming here last day
Hello.
in the afternoon and hope you enjoyed the Congress so far. Today's session is about neck challenge, high risk anatomy, advanced injectables, and regenerative strategies. Okay, I'm here with
Panredi.
Dr. Pan. Uh, we are co-chair for this session. Okay,
Yes.
please.
Okay, so let's start with the aging neck where beauty meets neglect. With please welcome Dr. Atinut Duangkeo from Thailand. She will present about the aging neck. Let's welcome her.
Thank you so much for your kind introduction. I'm Dr. Atinutungkal from Thailand. สวัสดีค่ะ Welcome to the last day of IMCAS Asia 2026. Okay, can I have the... Thank you. And I'm going to talk about the edging neck. And for this lecture, I have no conflict of interest. Let's start with the number first. Do you know that more than we think, we have about 73% of the patients that come to consult that they want to have some treatment for her submental or chin fat problem. But anyway, it's still the undertreated area. To achieve the aesthetic harmony, we should think of the face and the neck as the same one unit. You should not miss the neck area. And to achieve the good result, we better use the multimodal with minimally invasive because I'm not the plastic surgeon, so I prefer to go for the minimal invasive way. So let's start with why we have the edging of the neck. For the neck, I divide into four layers. We start with the skin. We have the collagen loss with photo damage. For the fat, we have the fat redistribution, some area of hypotrophy and hypertrophy. And the muscle also have the hyperactive of the platysma that can cause the vertical band, or in some case, there might have the weakening of platysma that leads to the dissection of the platysma band. And last but not least is the bone resorption that will cause the blunt cervical angle. In this paper, they divide the neck deformity into five categories. The first one is the skin redundancy, and the subcategory is the skin excess, skin laxity, the photo damage. And next is the submental fat fullness, the platysma muscle banding, the submandibular gland ptosis, and last one is the skeletal support, or the mean to the mandibular and hyoid bone. And every time before start my treatment, I always use the assessment with these two. For neck laxity scale, I prefer to use this IPSA scale, and I use the horizontal neck wrinkle scale. Also, with the submental fat volume, I use this scale to validate for my patient. And last one is Dido classification for cervical abnormalities. The reason why I use all of this because I want to address my patient to see that if you start to have something like class 4 in this one, and with my treatment plan or our treatment plan that we are going to treat together, if I can lessen the score into maybe score 3 or score 2, is it possible? If they say that no, she wants from class 4 to class 2 or maybe class 1, I say, okay, then you might be not the good candidate for aesthetic. You have to do like the surgical one. So we can set the real expectation for our patient. And the other one, with this picture, our patient can have the picture in the future, okay? And for the treatment, why when we treat the neck, it responds slower than the face? Because the neck has thinner skin with the dynamic stress from the movement in every angle and poor vascularity compared to our face. My philosophy go for these three. The first one, I treat in multi-layer, multi-plan from skin, fat, muscle to skeletal. I use the combination treatment. We have a lot. And I focus on continuity from the jawline to submental area to the neck, even to the decolletage, as I mentioned in the first previous slide, that we have to think it as the one unit. And I use this metric, the skin quality, submental fullness, muscle, bone structure, and for the skin quality, it has 4 subunit laxity, excess skin, horizontal line, and photo damage. I score from the 0, the inner one, the less one, and the maximum score is 4. And here are multi-modality treatment that we can use to treat for each problem. You don't need to use all of these. Just pick a few from each box, depends on your patient scoring, and then you can have the right treatment for right patient. I share my case number 1. She is a Thai female in her 48 years old. You can see that she has some laxity, submental fullness, and also from the face and the neck. And her facial aging type is the Sager type, means she has tissue drooping with the fat bulging and also with the some area of the laxity. And from that metric, I addressed that her main concern is the submental fullness, as you see it in the red dot.
Excuse me, could
Yes?
you, oh sorry, could
Ka.
you do not take a photo because the patient photo?
Okay. Actually, it's okay because all of them are consent. for this,
Okay.
Okay. So you can. Okay. The red one for the submental fullness and the excess skin laxity, and she want fast one single treatment. So my choice in her is the thread lift. I do full face thread lift as well as submental lift as well. I use the multi-directional barb thread, the molding one, and combination with the scaffolding thread around her eyes. And this is some of the video demonstrations just for the submental fullness. I use the hammock technique, pre-hole on in the center area, one in the left, and another reinsertion to the other way. In one single hole, you can use maybe like 2 insertion of the thread because the thread is not that big. But if you use like 1, 0 or 0 thread, I advise you to do 2 puncture, okay? And this is the result. Before and 4 months after only one single treatment of thread lift, you can see that lifting of the jawline area and also as well as nasolabial fold, because actually I do a full face lifting, and the submental fat has already repositioned, so she has better view on her cervical-mental angle. In this case, we can do the lifting, also with the fat reduction from color mapping, because for thread lift, it has the paper that they show that from histopathology, around the PDO thread, they also have the adipocyte denaturation. So the heavy volume, the heavy laxity, that want dramatic, immediate, visible result in only one single treatment, I go for thread. Case number 2, she is Thai female in her 55 years old. Her main problem is the photo damage with the excess skin and skin laxity. So for a photo damage, I prefer to use the polynucleotide. In this case, I do the combination with the microneedle RF for improvement of the skin excess and skin laxity. I start with the microneedle radiofrequency first. I use this parameter for continuous pulse wave, continuous wave, doing whole face and the neck. For the neck, I use shallower. I use only 2 to 5 millimeter only. Okay, and for polynucleotide, in this case, I use 2 cc injection into her superficial to mid-dermis with sharp needle to make sure it covers entire the neck area. And here's the result before and after treatment with the combination of the microneedle RF and PN for 3 sessions. you can see improvement a lot. And this is my last case. She is Thai female in her 62 years old, a little bit older. You can see the sagginess, and she is the single type. It means that she has a hollowness and descent of some area of the fat and skin laxity. And she also wants some immediate visible results. So I use thread. But as you can see in this case, I use more, focus more, emphasize more on the scaffolding thread to make like a little bit of the volumization effect. In this case, she didn't want to do the filler injection. Okay, and this is the before and 1 month after doing the thread lift, the visible immediate result. And here is from the other view. At first, I questioned that if I stop doing the right angle or not. So I check it again, and I measure the angle. It's the same angle. So this is the real result from the thread lift. In another view, so definitely we can get lifting effect. But is that enough? Because she looked much better on her face. So now she start to focus on her neck. So she come back to me again, and doctor, what about my neck? What can I do for her? In this case, she has a problem of muscle hypertrophy. As you can see, her vertical neck band, the photo damage, and skin laxity. So these are my treatment plan for her. I use botulinum toxin type A. I use microneedle radio frequency for skin laxity, skin tightening, non-cross-linked HA plus glycerin because her skin is very dry, in combination with injection of polynucleotide. And this is how I treat the toxin, okay? And no go zone here, otherwise you might cause some problem with the vocal cord, okay? As I address that, I always use the higher dose on the upper part, but lower dose on the lower part, okay? And next, I do the microneedle radio frequency with the continuous duration with the depth of 2 millimeters because this patient has thinner skin than the previous patient. And for non-cross-linked HA plus glycerin and polynucleotide, I use sharp needle. Non-cross-linked HA plus glycerin, I do only one single session. Polynucleotide, I just appoint my patient to come back to do like 4-week interval. And this is the result before and 4 months after full face thread lifting and the neck rejuvenation in the combination protocol. So I just want to address for you that the neck does not need to be hidden, but need to be healed. So our patient can gain more self-confidence. Thank you so much.
Thank you very much for your sharing.
Next speaker is Dr. Kim Jung-soo. And the title is Regenerative Neck Rejuvenation with Micronized ADM Filler, Clinical Efficacy of ADM PDLLA Injection using 30 gauge needle. Dr. Kim? Dr. Kim is not with us?
Yes, so shall we move to the next
Yes.
first? Okay.
Yes.
Okay. The next, okay, please welcome Dr. Noura Libar from Italy. She will present about the jawline and neck rejuvenation combined protocol. Wow. Combined protocol including the endodermal RF for a challenge area. Please welcome.
So thank you so much for being here a Sunday afternoon. It means that you're really willing to learn, and I will always share whatever I can to give for you the best tools for your practice. I will pass on my presentation. I mean, who I am. I think you know me now. And the aging process will not affect only the dermis, epidermis, and the fat. You know, we lose fat with age and so on. But one of my concerns today is to talk about the muscles, the aging muscles. So they age also. We need also sarcopenia, not only in volume, but they age. So how can we regenerate them? And one of the most requested treatments that I have is the definition of the jawline. To get this result, I needed to inject 6 ml in total of filler. Do you agree with that? No. Especially when the patient is young, it doesn't make sense. It will migrate and so on. Here, for this patient, 6 ml in total of filler. She's only 30 years old because she's insisted and it doesn't fit her. So let's find other trips. But when you inject fillers, when you inject it with needle, try to inject it on the posterior part of the mesenteric muscles and push the parotids also toward laterally to not avoid to inject. There, don't forget that, and otherwise use the cannula. We don't want to lead to that overfill syndrome or pillow face that you can see in celebrities. So that's not my approach. For this type of patient, what can you do? You can't feel her anymore, right? So I was using before the invasive radiofrequency, intradermal radiofrequency. It's okay, it gives results, but it's extremely invasive. So honestly, I'm not using it anymore because it takes time, it's invasive, it's risky for the mandibular marginal nerve, and so on. Not all they can have these results with a minimal quantity. I did tear trough, cheeks, lips, and I did the mesenteric treatment with botulinum toxin to have a very smooth face, if you see, but not all are able to use a very small quantity of fillers, so we have also energy-based device. You can really change and invert the aging triangle. So give a look to this patient. At 58 years, she was looking, when she came to me, even older than right now. Look at her jawline. I need to update the picture. She's now 72, 70 or 20, yeah, 71. And look at that jawline definition without any surgery. No facelift has been done. You can see her here, and I treated her platysma with botulinum toxin. One of my favorite treatments is botulinum toxin on the platysma because the platysma is the most responsible of the face sagging. So if you want to preserve a beautiful jawline, just inject it preventively, even since 30 years old. So don't worry for that. It's the very depressor muscle. So we have a lot of techniques for face rejuvenation. On the epidermis, on the dermis, we have energy-based device, injectable, but on the muscles, we don't have a lot, unless the botulinum toxin. So, but you need to know that the muscles, they represent until 30% of our form face. The rest is skin and fat and so on. So we need to work on the muscles. So as you see, you have regenerative medicine. Why not to have a regenerative energy-based device? Because I love the natural look. I love regenerative medicine. In fact, on myself, I do only very conservative and regenerative thing, because here, the facial mimics during workouts accelerate facial aging is true. If you see even the aging of the muscle, this is a patient, she's not working out. She's working out. She looks even older. So the muscles have importance. If you can see the difference after he starts working out on his muscles, so we can shape the face. We already talked about muscle contouring and so on, working on the muscle for the body, but we didn't talk about the face. Let's talk also about the regeneration of the face, with also working on the muscles and using contemporarily the effect of the radiofrequency. Because the radiofrequency will work also on the stimulation of the collagen by the fibroblast. Here we know all the effect of the radiofrequency. Can you stop the sound for any, we don't hear sound, that's perfect. So we're gonna target the elevator muscle, of course, because we want to have a lifting effect. We talk about diathermal contraction. So it's diathermal contraction. We will work on the lifting muscle with the elevator muscle, and you can have a lift in really short time. In 10 minutes, the session, it's not painful at all. We can combine with radiofrequency or not, depending if we want to have a minimally loss of fat and shaping of fat. Of course, we need to increase the temperature, and you can have also brow lift and so on. We really can talk about regenerative medicine because we will improve the volume of the muscle instead of filling. It's just about regenerating the muscle instead of filling with fillers, HA, no matter with fat, with lipofilling and so on. We can just work on our own facial muscle and improve the volume and have that shaping. If you want to have a look to my article I have published recently about a new approach for volume face restoration, muscle biomodulation, and you can appreciate and see how I worked, and you can see the lifting I obtained working only with the muscle, with diathermal contraction. After 3 sessions, you can see the lifting effect, also the contouring effect. I should reach with it the time because I can't see time. So just, yeah, huh? Perfect. Oh my God, this time I was really fast because I was in my last lecture. So you can see after 4 sessions, the lifting effect, but very naturally. We just increased the volume of the muscle. We didn't add anything else on our face. And of course, if you want to combine with the platelet-rich plasma, with any other, with nanofat, any other regenerative technique, because I'm really very conservative. I don't want to use, I don't like to, maybe, I don't know about the audience, but calcium hydroxyapatite and so on. I don't want long-term side effect. So look at the shape of her jawline, of the whole face, only after 4 sessions. And each session will last about maximum 20 minutes. That is not a big deal with no downtime. This is very interesting to have. You can see also the lifting on this case, and there are difficult cases. I will show you before that I have used the invasive, the endodermal radiofrequency. Honestly, I don't trust anymore in that. It's extremely invasive. Would you do that for yourself? So forever, whatever you propose to your patient, just do it for yourself. Look at the nasolabial folds, how they improve. Look, the zygomatic. So I worked more on the zygomatic muscle. So here, look, the lifting, the quality of the skin, the improvement of the skin texture, and also the volume. Then, what about the neck? The neck, I showed you my 2 best treatments are the first one, the botulinum toxin, to block the action of the platysma, which is the depressor muscle. The second, we can work on the skin texture that you can use, for example, the fractional plasma. You can also start with the diathermal contraction, with the minimum radiofrequency, because you can also choose the intensity of the radiofrequency, and then you can work on fractional plasma. As you see in that case, the results are really amazing. Of course, the downtime is a little bit longer than with the diathermal contraction, but the results are really amazing. Look at this case. This case, it's almost surgical, honestly. So we had a very interesting improvement, also after only 1 session of fractional plasma energy. Now, let's talk about the final glow that you need to give to the patient. The final touch, it's working on the epidermal level, superficially, on the epidermal barrier. So it's very important. Go and read about this paper. It's very interesting. The health, dysfunction of the epidermal barrier can give inflammatory diseases. So I don't want headache, I don't want downtime. What I do, I use the Glassifier, which is a regenerative topical product which has a very, very innovative way of delivery method. So I have these pickles that's gonna apply. They carry a GHK Cooper peptide. Once they are at 2 millimeters on the dermis, they will deliver, and once they are in contact of glutathione, they will deliver the GHK Cooper peptide. Okay, so we have more than 1.5 million of spicules, and they created almost 180 microchannel on the skin. So without microneedling, without any device, and they can deliver the all ingredients as peptides and give an amazing results. You can see some papers about the tripeptide, GHK Cooper peptide, to see the effect. And the last one is about the it will block the metalloproteinases. So also an anti-inflammatory, anti-aging effect. Here is my patient with me, very happy, and every time I'm using any device, I will end up my touch-up, because I love to show you my patient with treating them. You know, this is the same I showed you. She's 72 years old, and I'm treating her. I'm doing some high-flow ultrasound, high-intensity ultrasound, and doing some microneedling with glutathione. And at the end, look at her smile, because she had that glow, that final glow. on her skin, which is very important. Whatever treatment you do for your patient, filler, botulinum toxin, energy-based device, of course, not the CO2 fractional laser, for example, that whatever the epidermal layer is free, you can add the touch-up with the peptide speckles. So, which is
1 minute
absolutely
left. Okay.
oh my God, the first time on time. So absolutely non-invasive. It will give you that glow that nothing, can you see the patient immediately after the glow? So HIFU, high intensity ultrasound, and the glow on the face of the patient. Here it's me, 18 years before, no changes because I love to be conservative, to use regenerative medicine. I don't want side effects. Here I'm using the diathermal contraction for me. I love non-invasive devices which give the maximum results. Maybe in future, this will be the future, like the basic of the beauty, maybe. So we will not work that much. Now we love the jawline of Angelina Jolie. Maybe in future we will come back. So just to remind you to do meditation, to look on your inner beauty. It's very important because then when you do meditation, you connect to your soul, and your soul is ageless. So you're gonna be eternally young. So I invite you to be creative. Also, when you do meditation, you are creative. Here are my painting. I didn't know even that I was able to paint, but do whatever you do it with love, and you will be successful. We love Thailand. Thank you so much for your time.
Thank you, Doctor.
Thank you.
Okay. Now I invite Dr. Kim, and he's going to talk about regenerative neck rejuvenation with micronized ADM filler, clinical efficacy of ADM PDLLA, injection using 30 gauge needle.
Good afternoon. Good afternoon. I will talk about the very new material, the ADM. So my name is Jung Seo Kim from Korea. I'm a plastic surgeon. Actually, we have been used ADM 25 years ago, since 25 years ago. But nowadays we can using the powder type ADA. So let's begin with introduce my book. I want to give you for gift for all of you, but it is written by Korean language, so I will write the English version later. And then this is ADM, first ADM. It's used since 2000, unlike the conventional filler or conventional skin booster. ADM is acellular dermal matrix dummies act as something special. It promotes cellular ingrowth and acting like ECM and remodeling the skin texture and skin healthier. Today I would like to introduce something special processing method for ADM. This is the supercritical CO2 decellularization processing to the T cell to reduce the antigenicity. It is the same method to make the decaffeine technique using the supercritical CO2 technique. So supercritical fluid is CO2 is very special, so we can infiltrate very well and remove the antigen, so, and then preserving the ECM. Using the only CO2 gas, so you can remove the antigen. And then after that, the CO2 gas is going out, so 100% chemical free, so no remaining the chemical product. This is my home, and every evening you go home to rest and sleep. But let me ask you, what if you don't have a home? You cannot live without home. Our tissue is composed of two components, cell and then ECM. ECM is extracellular matrix. We may separate from conceptually, but biologically, they function properly together. The house protects you and support food and clothes and keep alive. Without house, the survival became difficult and sick. I can say cell is a human, and then ECM is the house. If you lose the house, we cannot sleep, you will lose, and then you will be sick. When the fibrosis are well connected to the health ECM, and then they stretch it alive, active, the production of some collagen. But when the ECM damaged, the fibroblasts lose their tension and fibrous collapse, such as the homeless bigger. So collapsed fibrous stopped producing the many collagen and many products for ECM. This is the aging process, and then we supply ECM, we can recover the aging process. You can see there, young people you can see the large, elongated, active fibroblast, and then damaged ECM, the fibroblast is shrink, and the shape also getting small and round. This is such as a homeless. So let's move on the horizontal leg fold treatment. The many doctors using the HA filler for the neck fold, but HA filler may make a Tyndall effect, so it was not good to treat neck fold using the HA. So I thought the ideal material is the dermis for the dermis treatment, dermal depression or dermal fold. So I prefer the implantation, the defect dermis with real dermis. This is my simple philosophy. This is before and after. The left side is before. There are many neck fold, but after treatment dermis, the result is amazing. I inject dermis into the dermis. The concept is very simple, but result is amazing. This is injection video. Injection is quite simple. For the neck fold, you mixed with the low BDD HA to reduce the pain, because only the ADM filler injection makes so painful. So I am using the 30 gauge needle. I inject 2 layers into the dermal layer, and then I injection a little bit under the dermis. The dual layer injection. Also the before and after, before and after. So the second case is a little old female, has severe neck wrinkle fold with skin laxity. This case, we need more challenging to treat. First, I inject the dermis, intradermis. Then I place second injection slightly under the dermis to support the soft tissue. This is the before and after. I could make some noodle, but we can treat this paired 1 month later. You can see the arrow area, that is the neck fold area. There are some anatomical changes. There is a lack of support tissue, and then connection, the dermis and under the tissue. So it's a little bit special condition. So we need to imagine when you treat neck fold. This is after treatment. I made some little lump because I injected the dermis. You can see the little lump in the dermis. Sometimes we can use the needle free injector to promote more aggressive dissection from the dermis to the deep tissue. And then you can see the white material is the ADM material. And then I could make some space and separate the dermis and subdermis. It can make better result. But problem is the recovery time is too long, 1 week. Another case, before and after. Many case, I did many case. This is a needle free injector. So fast, you can dissection, and then we can injection at the same time. Upper is this is before, lower is after injection. You can see the ADM material. This is before and after. Before and after. Before and after. So the ADM provided the scaffold. Sometimes ADM is absorption faster, so what can I do? So we can add some skin stimulator together. So we can add PDLLA or PLLA, can recruit the cell from our body and activate fibroblast more. So ADM can last longer when you mix the skin booster. So as I told you, let me think about that. What if you have a house, but what happened? There is nobody live inside. Dust accumulation, and then spider web appear, and house become abandoned. So house need people, the cell. House need cell to live inside and maintain the house and repair the ECM to keep alive ECM and the cell. It's the same in the body. ECM needs cell, fibroblast. So we can add some skin booster, PDLA or PLA, to bring it the cell and the cold cell, and then cell begin to restore together with the ECM, the better balanced regeneration system. Yeah? Thank you for your attention.
Last speaker, it's Dr. Chosung Kyun, and he's going to talk about histologic insights into CO2 gas-assisted drug delivery for facial and neck rejuvenation, educational grant from MCure. The stage is yours.
Can you hear? Okay. This one? Okay. Thank you this is going to be the last lecture for this session, I think. Today I'm going to be talking about neck rejuvenation using CO2 gas. Before I start the lecture, there's 4 messages that I'm going to talk about the lecture. That's all you need to know. If you're going to leave in 1 minute, just know these 4 things. First of all, the CO2 subcision will help with horizontal necklines. You need a physical stimulation break of the necklines to make actually mechanical breakdown for the neckline rejuvenation. Number 2, you're going to use CO2. Unfortunately, we have side effects from PDLLA, CAHA, and ADM when you have nodule formation, so you can use carboxytherapy to treat that. And also, it has a unique way of introducing biostimulators or skin booster into the skin. And also, we can also use this for hair rejuvenation, which I'll show some pictures a little bit later. So those are the 4 main messages I'm going to be talking about today. So I'm going to be talking about Trifil Pro. We use this device in my clinic, and I'm sure a lot of Korean doctors also use this. We introduce CO2 gas with a solution through a unique mechanism. So we're going to introduce the CO2 gas with a solution, but this device is a little bit more unique, where there's gas introduction first into the skin, which allows for the air pocket for the biostimulator or the product to be introduced. And also, after the product is introduced, we use another option of 1 or 2 shots of CO2 gas for better homogeneous distribution of the product itself. So this is just to show you the video. We're going to make an air pocket. Product will be introduced. And also show you again that a gas formation occurs. So the various effects of CO2, we all know. The subcision, it's going to reduce leakage, dispersion of solution, the mechanical stimulation, and also, of course, the Bohr effect. Nothing is new with CO2 fractional, right? Because it's been around forever. There's a lot of different machines that introduce CO2. But this machine is a little bit unique because you can control how it's introduced and how much air pockets you make after the solution is introduced, which reduces side effects and also helps with horizontal necklines, which I want to emphasize again. So in the end, it will reduce the horizontal necklines, not just through filling it, but also the physical breakdown, which is very important, which is shown in the lecture and also the article in a couple slides later. Okay, so the mechanical substitution is very important because before I've been using this machine, I've been using it mechanical, Norcor needles, or using a high gauge, a low gauge, 18 gauge or 20 gauge. And as you know, you sometimes have side effects of hematoma. You could have some PIH. But with this machine, it's very finite. It helps with breakage of the ligaments, so you have better product and end results using subcision. So just to show you from this video, CO2 versus manual and subcision. So you can see that instead of manual with the CO2, you get a better homogeneous distribution of the gas and the product itself. Okay, so as you see from this picture again, you can see that there's a creation of a space for the solution. The pocket forms, the product is placed into the pocket into the cavity, and then also another pocket is made for a more even distribution. This is very important because when we introduce some bright stimulators such as PDLA and CAHA, it can cause granuloma or nodules. And of course, I've had some cases in my junior doctors too. So I feel comfortable using this machine in order to distribute the PDLA into the skin more evenly without the fear of nodule or granuloma formation. So I like to use this for acne scars, chickenpox scars, necklines, and stretch marks. So when you see the product, the diagram here, you see that the product is evenly distributed. So you have a more uniform solution, so you're not going to have any chance of side effects. So again, we can emphasize that the Bohr effect will help with the CO2 gas. And the solution comes in, and another Bohr effect to distribute the gas and allow for collagen regeneration. So this is very important. Once you become accustomed to this machine, you could actually customize it. You could go into the settings, and you could have a 4-step injection where you have CO2 gas comes out after the solution 2 times or even 3 times. So why would you want it 2 times or 3 times? Sometimes you want distribution of the gas to come out more weaker in multiple sessions, just like when we do lasers. We change the pulse duration. Sometimes we want a longer duration. Sometimes we want a smaller, shorter pulse duration. So this machine is unique that you could be a little bit more precise, and you could see which you could customize your solutions and your indications in terms of scars and other concerns that we have. So you can see from the video here, the solution comes out, and you can also see 2 shots coming out. And for the next one, when we need 3 CO2 gas pockets, we can also do it this way also. Okay, so this is just a video showing you we can do with the horizontal lines. You can use a 30 gauge needle or 27 gauge, depending what you want. Some people feel comfortable bending the needle. Like if it's a hard to reach area, sometimes I will bend the 30 gauge needle and go in perpendicular, but in general, I like to go in horizontal like this. Just show another video. You could actually bend the needle like this to go in for normal injection and also the CO2 subcision. So you can compare both. So why would we use carboxy therapy? As I summarized in the beginning, of course we'll use it for those indications I tell you, but also great for dark circles and also great for cellulite and helps with rejuvenation. There's a lot of injectors out there. Of course, you can use injections that don't have CO2, but the reason I use this is because you kill 2 birds with 1 stone. Sometimes you want to have injections that will help with fine wrinkles and also with deep lines, and this actually helps with the machine compared to other machines that just do inject the product inside the skin. So this is an article that was published in Korea by Dr. Seo. So it shows you that large particle PDF dispersion within 6 days shows there's even more distribution with histological evidence provided in his paper that he published later this year. So you can either use, if you have a large PDLA, I prefer to use 25 gauge. Some physicians like 27, I prefer 25. I think it comes in more smoother. And just to show you, this article shows you after 6 days, you can see more neutral infiltration, in accumulation, and distribution, homogeneous distribution of the PDLA inside the skin. And you can see total fiber collagen change after 3 months compared to the PDLA without triple throw, it's more even distribution, more neutrophil accumulation in that area. Again, you can see this also with this study is that there's greater increase in collagen with a more homogeneous distribution, which is very important because it allows for less nodule formation and actually more a better efficacy. So again, the elastic fibers is also important. You can see that there's evenly homogeneous distribution. And also there was a paper published in Korea last year by Dr. Lee. It shows you that how PDLA is good for horizontal necklines. I agree with him that physical release is essential for true improvement. Of course, you can use HA fillers just to fill in the hollow lines, but if you have mechanical distribution, you could also release the fibers and produce longer effects of the product itself. So I like to prefer to use PDLA in combination with the machine, and also I'll use PN sometimes with multiple sessions. So you can see if in this paper, there's a lot of satisfaction after 6 months. As you know, if you just use HA fillers for necklines, the HA starts to disappear within 2 to 3 months. So some people like to use PDO threads. I used to do that before in the past, but now that I have this machine, I prefer using this with, again, PDLA and also a nice PN like Regeron. So this is my nurse. Before and after, we used Trifil Pro with PDLA. Also with PN, not on the same session. I like to use it on different sessions, 3 to 4 weeks apart. With this nurse, I did 3 to 4 sessions. There's another patient of ours. She has a problem with wrinkles on the marionette lines. So we use PDLA with Trifil Pro. We did 3 sessions. It works wonders. Before I used to just use Kaha, but now sometimes I use Kaha in one session. In another session, I'll use Trifil Pro with PDLA. There's another patient of mine. She has the same problem with wrinkles in the marionette line. It's very hard to treat with HIFU or other energy devices. It's not that effective. So you have to use energy devices in a combination with sometimes these type of skin boosters. But I like to use Trifil Pro to reduce the side effects, and also with the Bohr effect, absorbs the product more inside the skin. Okay, this is again. We have a lot of problems with scar management in Korea. Of
2
course,
minutes.
okay, of course, we like to use CO2 fractional lasers, but as we know, stronger treatment causes more PIH in Asian skin. So this is after 6 to 7 sessions. We use PDLA and combination PDRN in different sessions. Another patient of mine with acne scars, darker skin. We used Trifil Pro in combination PDLA and also PN in sessions. We interval back and forth after 3 weeks apart for 4 to 5 sessions. There's another patient of mine. It took a year for him to fix his procedures. I used XLV, KTP 532 in combination with Trifil Pro on PDLA and PN. Another patient of mine, I used KTP 2 sessions in combination with Trifil Pro and PDLA. Another patient, this is after 1 session of PDLA of Regeron and Trifil Pro. This is very important. When you have nodule formation, there's a lot of ways to treat it. Triamcinolone will not always do the case. HIFU does not work. I feel the only way that you can get rid of nodules in a fast way is using normal saline with a high CO2 gas inserted into the skin. If you have 2 to 3 sessions of this product, this wet method, I think most granulomas will go away. So this is a patient I had problem after using Kaha. After 3 sessions, we got rid of the granuloma 3 weeks apart. This is the settings I like to use when I use granuloma dissolvement. Okay, this is another, when we have scar and PIH treatments, this is a protocol I like to use. Okay, another for hair treatment, I like to use PRP mixed with Trifil Pro. So this is a machine that actually helps with the PRP growth factors come out even more. It's available, of course, Asia and Europe. It's very good. And you inject it for hair treatment. This is one of my patients. And why Trifil Pro? Less chance of nodule formation with the use of PDLA. Less sessions are needed. Mechanical disruption of fibrotic tissue cannot be replaced. So it's essential in horizontal neckline treatment. And of course, you can reduce the risk of PIH and other adverse effects. Thank you for your time.
Thank you so much. Join us.
So the next is Q&A session. If anyone on the floor have any questions, please ask the panel. Do you have any questions? If not, first thing first, I would like to ask Dr. Atinut, do you have any prevalent kind of case that you will use multi-modality, for example, thread, RF or any biostimulator? Could you share with us?
Okay, sure. First thing first, the patient that need quick immediate result with one single treatment, my choice go for thread, okay? And the next one for a problem with muscle, our choice go for botulinum toxin type A. And the other like the skin quality, skin laxity or photo damage, I always do the combination between the EBD and injection. For the EBD, for me, I prefer to use the microneedle IF because I can make sure that I have precise depth of the frequency that be there because the skin of the neck is very thin. Okay, but anyway, you can still use the like HIFU for some area, especially for the submental laxity and the jawline. And for the injection, I prefer the PN for a photo damage case. And in the patient with the not too hydrated skin, I will use the non-cross-link Haya that have glycerol to make hydration. And the other one, I will use biostimulator, but not a strong one because the skin here of the neck is very delicate area, and we have to use less aggressive treatment of biostimulation. Thank you.
Thank you. Do you combine two modality in the same time?
Yes, I did combination. If patient, I'm going to do the EBD first and then injection, and toxin always the last one for me.
Okay, thank you. Gloria, do you have any question?
I have a question from Dr. Kim. In terms of using ADM and biostimulator, do you do it in one, like what's the interval between these two?
Now I mixing together and I inject one session.
Oh, you're
Yeah,
mixing
yeah, one session. So
in the clinic.
yeah. So I wanted to positioning ADM and then skin booster. So skin booster called
For the ACM.
fibroblast or the foreign body reaction, and then there is pre-mixing injection is better to even distribution.
And what's the formula of the mixing? For example, if you want to mix it, you mix
We
with PLLA, you mix with
actually
calcium hydroxyapatite, or
any stimulator is
Any
okay.
biostimulator.
More Kaha, Jubero, Sculptra, anything okay. But I mix only the 5% butter. So if one bottle you can use 20 people. So we need a very small amount for the skin stimulator because the main mechanism is ADM, and then ADM is a cell, house. We need a small cell only, so we mix only small stimulator.
but biostimulator dilution is the standard dilution.
Very
that
huge, very
you
huge.
use.
Yeah,
Okay.
maybe 1 to 10, 1 to 20. Maybe.
Fine. Thank you.
Does any question on the floor?
I have a question
Okay.
for, sorry, Dr. Cho. Yeah, so I'm from Italy. We have been using carboxy therapy since really many years for cellulitis, for many other indications. But I can tell you that it's really painful, and especially on the neck. So I know for cellulitis we need to use even 1 liter, 2 liter of CO2, and the session is very long. And what do you think about the pain? I don't think they like that. The patient, it's really very difficult to convince her. It's very painful.
Yeah, I mixed a little bit lidocaine also with it, and
But lidocaine is toxic, and we need to add more things.
I still it's a short burst. So I don't think it's that painful. With the neck, I don't have too many problems with the patient complaining about pain. But I do have a regular CO2 machine. When you put 1 liter in the belly, it's really painful. But these are short bursts in the neck, so I don't think it's that painful.
Yeah, because once you inject the lidocaine, I mean, the pain is immediate. So it doesn't make sense injecting lidocaine because then you need to do nerve block for all the
I
neck.
do nerve block
You know what I
sometimes
mean?
also, but most of my patients I
But
put
does it worse for such a simple treatment?
I usually do multiple stacking treatments. So most of my patients, not most, but 30-40% under propofol anyway. So I do a lot of patients under, going under. But I don't think it's that painful. Like if you do you do PN treatments? or skin Botox.
It's really painful.
painful,
No,
but
it's
Koreans
more
are pretty
painful than
tough.
anything.
And
No,
I-
the CO2 is really painful. I don't know who tried it on themselves. Have you tried to inject the CO2 gas?
No.
No.
it is
I
painful.
tried on myself.
It is painful.
And the patient, they just shout, and then I just get rid of the machine. The patient like, no, they're not shouting like for a half hour, half an hour, stop.
But
go
I
away.
don't know. I haven't had too many problems with, they don't complain too much. It finishes fast. 5-minute procedure.
Okay, thank you very much.
I have a question to Dr. Nura. As you share many cases of the neck rejuvenations, could you share about what is your technique to prevent the complication at the neck area?
Okay, depending what you inject at the neck area. So what I inject, so the neck area, remember that the skin is extremely thin. So whatever you inject as cross-linked filler, as CAHA, if any granuloma, anything, it will show. So I avoid this area. I inject just, or I do energy-based device at the fractional plasma, and you don't have any side effects, unless the patient, she will go and be tanned, okay? She will expose to the sun, and she can have some hyperpigmentation, post-inflammatory hyperpigmentation. Then the botulinum toxin for the neck is absolutely harmless, so there is no side effect. Someone, when they inject on the medial part, maybe too deeply, you can have some deglutition problem, but I never had any. I have been injecting as Nefertiti lift technique botulinum toxin for the neck and jawline. I never had any side effect. And the third thing that you can inject, like non-cross-linked HA, is better, even better. PRP, platelet-rich plasma, already pre-mix it with non-cross-linked HA. For me, it's one of the safest products that you can inject on the neck. Because if you inject even a non-cross-linked HA with high molecular weight, it's gonna leave you like pebbles for 2 days. So they don't like that. And then I can inject something superficial as peeling, as TCA with hydroxide, with peroxide hydrogen, or my peptides, my microneedling, simple microneedling with peptides. So avoid, neck is very delicate, be careful. And it doesn't heal easily. It takes time to heal. If you do some fractional CO2 laser, so on, like it takes like double time if you compare with the face, because we have less vascularization. And of course, you will not inject huge quantity of gas, of CO2 gas on the neck. You know that you will have a lot of volume. You don't want that.
Thank you so much. If any question, because we have 3 minutes left. If it's not, we can wrap up this session.
Share his experience. Irene, Nalini, you want to share something with us? How you treat the neck, Dr. Nalini? Come. Oh, everyone knows Dr. Nalini in Thailand, right?
I just try to use things that has the least nodules on the neck. So, first of all, botulinum toxin, to be sure. And I don't know that I'm allowed to tell the brand, but the one that is the filler that is spreadable, that is what I use. I love it. Last week I have a patient, a man, and he told me that, Nalini, because of your injections, I have to buy Ames to put it on the neck. But it takes time for, if you have a big nodules, to go away. So what I'm doing is that I modify. I inject to be a smaller nodules, but it's spreadable. So no nodule left.
Yeah, I forgot also what's one technique that I use. I completely forgot. The high intensity ultrasound also. I love them because you go in a different depth and you're gonna stimulate the muscles, and at the same time you will stimulate the skin, the collagen stimulation. And also the device I have showed before works amazingly. We talk about diothermocontraction. So it contains, I don't know if I can say the name of the device. Yeah, I think yes. So the name of the device is from Italy. It's named Jovena. So I really love it because it's combined between fractional plasma, as you saw, what I have used before, and diathermocontraction. So we work on the muscle and we work with the radio frequency to stimulate the collagen. And it's absolutely non-invasive. There's no invasivity and no downtime. I love using devices, techniques that doesn't leave any downtime, because nowadays the patient, they will tell you, even for a small bruising, no, I don't want any bruising. Oh my God, what did you do to me? So imagine if you give them like a chronic nodules or any long-term side effects. So just
Yeah.
we need to choose like non-invasive.
I agree with
procedures.
Nora. Before the new fillers, I used to do some jet or something at the neck of, besides the arterial therapy, some injections, but besides here, and you can just leave it with the strong fillers. You can do that as well, or even the Energet in the past. And for the carbon dioxide things, I love it very much. And I think we can add one indications. If you have a wound, you can inject around the wound to have wound care as well. Yeah, it's make oxygen delivery to the wound.
Okay, thank you so much. I think it's time to wrap up this session.
Yes.
Thank you, everyone. Thank you, all the speakers, and hope you enjoy the rest of the sessions.
Have a nice day. Okay.